Good morning. Brief description, very small description about osteotomy as well as implant placement in Cortico Basal implantology. So I always prefer with single drill technique. If the bone is good and it's hard, you can go with the second drill or the third drill. But usually two drills are enough to place the implant in Cortico Basal implantology. So here, what I want to say is even the technique. The procedure is simple. It's basal implantology is a technique sensitive. Technique sensitive means you have to be thorough with all the anatomical structures. So where you are going to place the implant, especially in the nasal floor as well as in the posterior maxilla as well as in the mandible. In the maxillary posterior region, you have to be careful with the maxillary sinus area. That is, you can place the implant in the anterior wall and the posterior wall of the maxillary sinus, as well as you can place the implant in the pterygoid region. In the pterygoid region, we can place the implant. Start placing the implant on the tuberosity of the angulate and place it into the pterygoid plates. That is the area between the lateral and the medial pterygoid plates. So here the corticobasal implantology, simple techniques, single drill or otherwise two drills. Then you go with the placement of the implant. So about any confusion about which implant to place, you can use all kinds of implants. The most preferred one is bicortical screws, that is we call it as BCES or BECES implants, wherein the threads will be at the apical end of the implant. These are all polished surface implants, so the chances of infection after placement is very less, it's minimal. So all the polished surface implants where you are going to place, those implants will not cause any kind of infection most of the time. So another implant is the compressive implants. It's the same as the conventional one, where the surface of the implant is surface treated with SLA technique or other some more techniques are there. You can place these surface treated compressive implants in the molar area, that is in the maxillary posterior as well as in the mandibular posterior region. But I place these compressive implants in all the areas sometimes, so that is in the anterior, posterior, in all the areas of the maxilla and in all the areas of the mandible. So only thing is, keep it in mind, the osteotomy should be good. Okay, you should do proper good osteotomy, then you can place the implant easily. So after placing the implant, the main thing is the primary stability. If you are good at placing the implant with good primary stability and anchorage, the life of your implant as well as your processes will be good, and the patient will be happy for many more years. So keep all these things, simple steps in mind, and do osteotomy as well as a placement of the implant in basal implantology technique.